Hello guys, hope you're all doing well. We thank God for the gift of life He has granted each and every one of us. So guys, hope you're all keeping safe, you're wearing masks, keeping the social distance, washing hands frequently, and as always, sanitize. So guys, I hope you are learning something on COVID-19. We may not learn everything because it was a wide topic, as I told you. So I tried to shorten the notes and I just present which I feel like things that I feel like they're important to know for us. So today we are going to talk about IPC, infection prevention and control, and this is all about our general hygiene, both at home, at workplaces, while traveling. Yes, this includes hand hygiene, which is hand washing, and our general hygiene. But at this point we will go through because we all understand that in health facilities is where there is high risk of transmission of infection, because especially the healthcare workers, we interact with different patients with different conditions, so we are not sure of whether we are interacting or we are whether we are transmitting the disease from the patients or we are transmitting this disease to the patients. So we have to know, and we have to know the basics or the precautions that we have to take to prevent the transmission of the infection. So health facilities are ideal settings for the transmission of infections. That's from the healthcare workers to patients and to patients to the healthcare workers. We have the standard precautions and the additional precautions. Standard precautions are the practices used in the care of all the patients all the time. The standard precautions, these are the precautions that we have to take when attending to patients all the time. Yes, like washing hands, wearing our gloves. At this time we are talking of the wearing of our masks properly, and you make sure that the patient also has the mask while you're attending to him or her. Additional practices used in the care of patients with confirmed infectious disease, also known as transmission-based precaution. If a patient is confirmed to be, for example, COVID-19, at this time you are nursing a COVID-19, you make sure that you have full PPEs, that's from your head to the toe. You have your cape, you have your goggles, face shield, you have your gowns, you have your mask. We are talking of the N95 mask. We are talking of footwears. So you understand. Components of standard precautions: we have hand hygiene, which is hand washing and proper use of personal protective equipment. Safe injection practices, management of healthcare waste and safe handling of sharps, cleaning, disinfection and sterilization. Respiratory hygiene and cough etiquette. Respiratory hygiene, cough etiquette. Please, if you feel like you want to cough, if it's too much, make sure you cough. If you want to cough in your mask, flex your elbow and cough into your elbow. If you want to sneeze, maybe you don't feel comfortable sneezing with your mask on, just take your handkerchief and sneeze in your handkerchief. If you have a serviette or a tissue, use a serviette and then discard it. Make sure that you keep the social distance. You do it in an open place so that you make sure that you don't infect others if at all you have an infectious disease. Yes, transmission-based precaution. Standard precautions plus contact precaution, droplet precaution, airborne precaution. Hand hygiene. We all know what hand washing is. This refers to action of cleaning our hands by either using soap and running water, or you can use alcohol-based hand rub, that's using hand sanitizer. This is very important. And by the way, we will learn about hand washing later, and we will all learn how to wash our hands properly. Hand washing normally takes from 40 to 60 seconds, or at least 20 seconds. Then hand rubbing, that's hand sanitizing, it only takes 20 to 30 seconds. Yes. So what's the difference between hand washing and hand sanitizer or a hand rub? Hand washing, we use soap and running water. For hand rubbing, we use alcohol-based hand rub or a sanitizer. We wash our hands if our hands are visibly dirty or visibly soiled with blood, body fluids, or after using the toilet, before and after eating. We cannot use a hand sanitizer when we want to eat. So probably we have to wash our hands and feel comfortable. Make sure our hands are clean, and then we handle our food. And we wash our hands when our hands is visibly dirty or soiled. If you know that you have dirty hands, please make sure you wash your hands. I see some people, they have dirty hands and they are using sanitizers. If your hands are soiled, maybe you have touched blood, make sure you wash your hands. Don't use sanitizer if your hands is visibly dirty. If hands are not visibly soiled, that's when we use a hand sanitizer. Yes, 5 moments of hand hygiene. When do we wash our hands? When do we sanitize our hands? Before touching a patient, before clean or aseptic procedure, after body fluid exposure, after touching a patient, after touching patient surrounding like the beddings, the linens. This normally applies in health facilities, that we have to wash our hands. Yeah. Other moments, we know them: after visiting toilet, before or after handling food, on arrival at your workplace, and after leaving your workplace, you have to wash your hands or sanitize your hands. Before and after gloving. Healthcare practitioners, nurses, doctors, did you know that you have to wash your hands before gloving? Now you know. Let's wash our hands before we glove and after gloving. Hand washing takes 40 to 60 seconds, as I said. Let's look at the PPEs, personal protective equipment. What's a PPE? It's a specialized clothing worn by an employee for protection against infection materials. Yes, PPE should not be worn by only the healthcare workers. It can be worn by any other employees who are at risk of transmitting the infections. Yes. A guide for PPE selection. You must do a quick assessment by asking yourself these questions. Am I at risk of exposure to blood or body fluid? If yes, wear your PPE. Is my face at risk? For example, you have a client and this client is coughing and he or she doesn't have a mask. Is your face at risk of contracting or of transmitting the infection? If yes, wear your face mask properly. Are my hands at risk? Of course, yes. Wear your gloves. Are my clothes at risk? If yes, put on the full PPE, that's the gowns. Is the patient known or suspected to have infectious disease? Yes, those are the questions that will guide you on the type of PPE selection. Yes, appropriate use of PPE. Purpose is to protect healthcare workers from infectious diseases. Use in addition to hand hygiene. As much as we are using the hand hygiene, make sure that also you wash your hands frequently. Not always essential to use all the items of the PPE as part of standard precautions. It's not a must that you have to be in full PPEs for you to attend to a certain client. It depends. Is this patient a suspected case? Is this patient presenting with signs of COVID? That's when you will go to your management or your administration. If possible, if you require full PPEs, that's from the head to the toe, head to toe, from your head cap, from your goggles, face shield, mask, gowns on, your footwear, your surgical gloves. Yes, so it all depends. But if there is no need for full PPEs, then make sure that you have your most appropriate. We are talking of the surgical masks and the gloves. Those are the most important PPE that we need, especially in level 2 or level 3. We need masks and we need gloves. As we don't come directly in contact with the COVID-19 patients. Those who nurse or who take care of the COVID-19 patients, they must be in full PPEs, including the N95 masks. Yes. Full PPEs, I've said, it includes the head caps, goggles, face shield, surgical masks, gowns, footwears, and the gloves. Caps for hair and cloth footwear can be optional, they are not standard. General principles when using PPEs: you have to perform hand hygiene before handling and putting on the personal protective equipment. Immediately remove PPE after completing the procedure to avoid contaminating other places and surfaces. Immediately remove and replace broken pieces of reusable PPEs. Do you think PPEs are reusable? They should be discarded immediately after use. You don't have to reuse the PPEs, especially those who work in high risk areas or those places that are highly infectious, like those who come into direct contact with those patients with COVID-19. Those PPEs should not be reused again. Properly discard all single-use PPE immediately after use. Perform hand hygiene immediately after removing and discarding any item of PPE. APC measures at screening sites. Standard precautions should always apply. That's the social distancing, cough etiquette, hand hygiene. Infection prevention and control starts with you, by the way. And let's all be cautious of what we are doing, and let's all be responsible, because we all have to learn how to cope with this new life. And so guys, wash your hands, wear your mask properly, keep the social distance, learn the cough etiquette. Yes, and I think let's just be responsible citizens. Yes, and that's the end of our topic, guys. I think we will not touch so much on COVID-19. On our next presentation, I think I'll present on them. I just feel like everyone should know. I will present on psychosocial support and handling of the dead. Yes, handling of the dead, guys. We have to know these things because it's here with us. For now, guys, I wish you all the best in all your endeavors. Keep safe, continue praying, and all this will come to an end. I love you so much, and please, before I go, subscribe, like the video, leave a comment if you have a question, if you have a concern. Let's share together, guys. I love you so much, from my heart to you. Bye.